still remain your favorite gynecologist and favorite fertility specialist, Dr. Adebayo. I want to talk about what we call egg freezing of egg. We all know that a woman releases egg every month, which is what we call ovulation. The beauty about the eggs of the woman is that she has all the eggs she needs in her ovaries. In fact, she has over 400,000 eggs. All right, and she releases one or two every month, and that's what we call ovulation. These eggs continue to supply. It is a need for fertility or for pregnancy. That's what means with the sperm and forms pregnancy. But these days, we have what we call assisted reproductive technology that has helped to rearrange a lot of things. So these eggs, occasionally, as they grow, not occasionally, usually, as a woman grows, the quality of the egg begins to drop. In fact, the egg of a woman is most fertilizable when she's less than 30. From 30 and above, the possibility of egg fertilization begins to drop, and it drops drastically after 40 years, which brings to bear what I'm talking about today: freezing of your egg. So now we have what we call assisted reproductive technology, where you can now keep those eggs when you are young, so that in case you need to wait till a certain age before you get pregnant. Let me break it down further. Some people now, because of career, because of maybe marital issues, because of deliberately, sometimes voluntarily, sometimes. Some people, because they know that they may be having some issues. Some people are under chemotherapy, radiotherapy, and they know that there may be problems with their eggs. Some persons also may just feel, just let me keep my egg. We decide that I can now keep my eggs to be used at a later date. So the idea is this: you are younger than 30 or younger than 35, because usually after 35, we don't like doing much of keeping of eggs. You want to keep your eggs so that anytime you are ready, you can now use them to fertilize through IVF. So this is great news. We don't have to wait till when we are very old, or we're around 38 or 39 or 40 and trying to get pregnant and your eggs are no longer viable. You can keep them, and when you're ready to get pregnant, you can use them, and then you get pregnant. And these services are available everywhere. You can even contact me to know more about egg freezing. So good news, you can decide when to get pregnant. You're still using your egg, but please get more information and then use your eggs when you should, not when you're too old and they're no longer viable. Thank you for your time.